go on their brain. So we make for them their bed, and these are the requirements that are needed. On our trolley, on the top shelf, we need a long Macintosh, we need a bottom sheet, then we need a draw Macintosh, draw sheet, then we need admission sheets. We have the bottom one and the top one. Then we have a top sheet. We need a bed blanket and then a counter pin. So this bed is just a continuation of an admission bed. So that's why you're seeing we have 4 bed sheets, and you have the blue sheets, as our admission sheets. Then we need a pillow, and then a draw sheet that we shall wrap this pillow in on our bottom shelf. So those are requirements on the trolley. However, we need requirements on other sides. We need a screen, which is right here. We need a head injury chart for monitoring the patient. These patients really require constant observation, and we chart everything on the head injury chart. So we also need bed blocks, and these bed blocks are put at the top of the bed to raise the top of the bed so that we decrease the intracranial pressure. But if you have that modified bed, you'll only raise, or you can use a switch or a remote to raise to about 30 degrees so that we reduce the intracranial pressure. Still at the side, we need a suction machine. These patients usually get problems with their breathing. Secretions go and block the airway, so we need a suction to suck out those secretions. So still about the requirements on the side, we need an observation tray because they need constant observation. So we have an observation tray to take their vitals, the BP, the temperature, the pulse, and the respirations. Then we also need a Macintosh, a small one, and a cover, a towel. So this is to put at the head of the bed in case the patient has bruises, they are bleeding, to protect the bed, and in case there are secretions coming out of the mouth. Then we also need catheters. We have a urinary catheter. They'll be on constant bladder drainage. And then we have a suction catheter to change in case the other one, the suction machine, gets contaminated, or to put in case there is nothing. And of course, we need a hand washing facility or a hand rub, and our 2 chairs. So that is the bed. Those are the requirements for a bed for a patient with head injury. So since bed making is a 2-nurses procedure, I'm going to call my assistant that you can make this bed. Thank you. Okay. So as usual, stand in the middle, but we need to first wash our hands or contaminate, infect. So these bed rails are needed for a patient with head injury, but because we're going to make the bed, we're going to first lower them. Put them down. We're going to make the bed, and then we pull the bed around the wall. Check firmness. Straighten we get our top admission sheet. We shall meet at the bottom. Then we get our top sheet. We leave them hanging. We get our blankets. Now counter pen. So I'm going to fold to the center. So our patient is admitted between the admission sheets. And when we give them a bed bath, we shall remove them so we get our pillow and wrap it in a draw sheet. And then we put it at the head of the bed, just like this. So you can use your draw sheet to hold it so the patient does not hit the bar of the bed. Then we shall get our put where the head will be and then protect. So that makes our bed for a patient with head injury. And then after we draw back the bed to the wall, we clear away, remove the screens, ready to receive the patient. So when the patient comes in, we shall raise the side raise. Thank you.